Another video from Medico. In this video I will discuss second cervical vertebra. This is also called axis. It is identified by the presence of the dens, which is also called odontoid process. I will show you image. In this you can easily identify the dens or odontoid process. So look at this image. In this image, this is the anterior view of C2 vertebra, which is also called axis. In anterior view, we see this process here. This is called dens. So let's draw this. Next, we will see what are the features of dens, which is also called odontoid process. Odontoid process are normally strong. They are tooth-like process projecting upwards from the body. It is usually believed to represent the centrum or body of the atlas, which has fused with the centrum of the axis. Actually, if we look at this image, in this image, this is dense, this is tooth-like, this is strong, tooth-like and strong. So the dens is usually believed to represent the centrum or body of the atlas. What happened during the process of evolutions, the body of atlas got fused with the body of the dens, so that formed the odontoid process. The dens articulates anteriorly with the oval facet on posterior surface of the anterior arch of the atlas. If you look at this image, this is the dens. This on the anterior view, we see this is the anterior articular facets. This anterior articular facets articulates with the anterior arch of the atlas, which has a facets on its posterior side, and posteriorly with the transverse ligament of the atlas. If I show you image, unfortunately this image is not here, so just remember posteriorly here if we see, this is the posterior view of the axis. In posterior view, what we see, this facet, which is posterior articular facets, which provides attachment for the transverse ligament of the atlas. Next, we will study about the vertebral arch in case of axis. Vertebral arch consists of lamina, which are very thick and strong. If you look at this image here, this is the posterior view. In this posterior view, we see this part here. If you zoom it, this part here is lamina. Next, there are articular facets on the vertebral arch. These are two in number: superior articular facet and inferior articular facet. Superior articular facets and inferior articular facet. Superior articular facet articulates with inferior articular facet of the atlas to form axial joint. Look at this image here. If you look at this image, this is the base of skull. And this vertebra, what we see, it's C1 vertebra, and this vertebra is C2 vertebra axis. So C1 vertebra, that is called atlas, has inferior articular facets here. This is inferior articular facets of atlas, and this part which you see here, this is superior articular facet of axis. These two forms a joint which is called atlantoaxial joint. Next, regarding inferior articular facet. Inferior articular facet articulate with the third cervical vertebra. Corresponding third cervical vertebra, they are bound. If you look at this image here, in this image, this is atlas, this is axis, and this is C3 cervical vertebra. If you closely look here, this is the superior articular process which bears facet of C2 vertebra, and here this is the C3 vertebra. This also has superior articular facets. These both forms joints. So these were all about the articular facet. Next is a transverse process which is very small and bears transverse foramen. If you look at this image here, in this image you can clearly see this part here is the transverse process which bears a foramen here. That foramen is transverse foramen. In case of axis, that is cervical vertebra to C2 vertebra, the spine is large, thick and very strong, and its tip is bifid. If you look at the spine of axis, that is C2 vertebra here, this is the spinous process here, this is thick and it is bifid. You can see here, this is bifid. So that's all about the C2 vertebra. Next, we will study about the another vertebra, that is C7 vertebra, which is also a typical vertebra. C7 vertebra, this vertebra is also known by the another name. This is called vertebra prominens. Why this vertebra is called vertebra prominens? Because this vertebra has long spinous process. If we look at the image of C7 vertebra here, I show you. Yeah, in this image you can see the spinous process. This is the spinous process which is long. Spinous process which is long. Next, spinous process is long. It is thick and nearly horizontal but not bifid. But in case of axis, that is cervical vertebra 2, the spinous process was bifid. So if you see here, it's long, thick and nearly horizontal, and it doesn't have bifid type of structure which used to be in case of C2 vertebra. Next is the transverse process in case of C7 vertebra. Transverse process is large in size and bears transverse foramen, which is small and sometimes double or maybe entirely absent and doesn't transmit vertebral artery. This is one of the most important point regarding the transverse foramen. If I show you a typical vertebra, cervical vertebra and C7 vertebra here, this, wait 1 minute. Yeah, This is C7 vertebra and this is typical cervical vertebra. In C7 vertebra, if you see the transverse foramen, it is double here, but in typical cervical vertebra only one transverse foramen is there. Sometimes it is doubled, sometimes single, and sometimes it may be totally absent, no transverse foramen. This is characteristics key features of C7 vertebra. And doesn't transmit vertebral artery. If you know in the transverse process here, this is C1 vertebra, this is C2, this is C3, 4, 5 and 6 and 7. So from the subclavian artery here, one artery arises, that is vertebral artery. Vertebral artery passes through all the foramens of transverse foramen from C6 to C2 vertebra, but they doesn't pass through the transverse foramen of C7 vertebra. So here I told you like transverse foramen of C7 vertebra doesn't transmit vertebral artery. There are two tubercle in transverse foramen, that is anterior and posterior tubercle, which you can see clearly in this image here. This is C7 vertebra anterior view. In anterior view, you can see in the transverse process there are two tubercles, posterior tubercle and anterior tubercle here, and in between there is transverse foramen. So that's it about C2 and C7 vertebra. See you in next video.